Thanks for staying with us. We've had different cases of medical negligence on the part of nurses, especially just recently a child was lost due to negligence and the incompetence of nurses. The professional nursing practice and standards of competency in Nigeria has been questioned severally because of these issues. Joining us to discuss this is Adeola Adetokunbo, Assistant Director of Nursing Service working with Lagos State Health Service Commission. You're welcome to the show, ma'am.
Thank you very much. Good morning.
Yes. So we've had different, some of us have actually experienced some of these things. Negligence on one hand, nurses, lack of care on the other hand. Who, of course, we have some very good nurses who know their onions and have the emotional capacity to do their job, right? But we have many of them as well who don't even understand. And because of one of these things, I have a personal experience myself on this issue. You know, the child gets either hurt, some other people get to lose their loved ones because of this. What can you say is happening in our system? And I know that a lot of people try to blame the fact that the nurses are not paid well, this is happening, the conditions of work are not so good, and that's what is affecting the nurses. But I'd like you to speak to that.
Thank you very much. I would say that's not an excuse. We all took an oath in school to save life. And if you cannot save that life, don't injure more. Don't cause more harm. I hope you understand. Yes. So, saying workload, working conditions, they actually could have aided your practice. But that shouldn't mean you should not do your job as a nurse. Because we all have our professional ethics. There are standard of rules, standard of practice that has to be followed. And every nurse must follow it. If you don't, you hear there are punishments available for such nurses. And most times when we talk about nurse, this she's a nurse, there's a nurse, that's a nurse, I wonder, are they really nurses? Because in this part of the world, a lot of people, you know, they come because they wear white, they've been in the private hospital. You will agree with me that recently, one of the doctors caught somewhere in Ikodu performing surgery, who is just a secondary school holder.
Yes, I remember the story.
So that's how you have them in nursing. They don't have the required education. They don't have the required knowledge. Neither do they have the skill. And because they feel, oh, this is what they do, I can do it. It's true, you can do it, but that does not make you a professional. Because when things goes wrong, what do you do in the case of emergency? That's what makes you a professional.
So there are several kinds of nurses we used to hear. Auxiliary day, chemist nurse, mommy nurse, auntie nurse. You know, please categorize which one is professional.
Yeah.
It's important.
You have the right. You have the right as an individual, as a Nigerian citizen, to ask whoever wants to attend to you or who is attending to any of your relatives to be sure if such person is a nurse. A nurse is one who has the required education, have the knowledge, have the skill, have the competency to practice as a nurse, and he or she has been licensed by the Nursing and Midwifery Council of Nigeria. Anyone who calls him or herself a nurse and is without the Nursing and Midwifery license is not a nurse, because you must be licensed. Though we can't go about with our practicing license, but you can have a copy.
Yeah.
You can have a copy like we have.
If I walk into a hospital and you're wearing white,
how will I know?
You're in the nurses station.
Yeah.
In fact,
I will not be
even
asking.
driving you if every time you go to the hospital, where is your certificate?
Yes.
I believe.
Shouldn't the hospital be? So I think the question now would be: how is it possible that hospitals would employ nurses who are not qualified nurses?
Now let me make some clarification. If you are using a government hospital, you know government don't encourage quackery.
Yeah.
So you don't find a quack. So anyone you find in a government establishment
Is qualified.
is qualified.
Okay.
Such nurses are licensed. Now, if we move down to private-owned hospital, that's where the problem comes. Depending on how your capacity is. If you go to those big private hospitals where they could afford to pay
the
nurse,
qualified nurses.
the qualified nurses, you will find them.
Okay.
You may find other staff as auxiliary staff, but the main person that will attend to you will be a qualified nurse. Now, when we move down to our community and locality, please, we need to be careful where we take our relatives. That's where the problems comes in.
I was going to ask, because sometimes it's not just the competence. Sometimes you meet a qualified nurse and she does not have a good bedside manner.
Yeah.
She's
emotional.
completely, you know, I remember when I was giving birth, the nurse there, I was in pain. She would just be saying from far, sorry, you. She would watch me crawling to the toilet. She would not even escort me.
Wow.
And I'm sure she was qualified. So you meet the qualified ones who don't do their job properly.
Well, you have the right. You have the right to, to complain. You have the right to sue. You have the right for your own health because she's trained to give that service. So you have the right to ask why she's not giving the service she has been trained for.
When you're in pain, you will not be thinking about that.
After the whole scenario, when you've given birth, well, no.
So how do we avoid having qualified nurses who do not have the emotional empathy to go with the job, right? There were a few nurses I remembered growing up because at some point I was sick a lot and, they would take me to the Federal Medical Center that was in Delta State, Asaba at the time. And there was one particular nurse that stood out who would talk to me, would look at my face, would sing for me. I was a child. I can never forget that nurse's face. I can't remember her name anymore. But that care stood out for me. And we had other people. In fact, any day we go to the hospital and she's not on duty, my grandma will be calling, where are you? Please come. We need you. We need you to come, because I would not want to see another nurse because of the way they would talk, okay, go there, do this, do that, do that. There was no care. And they were all qualified, Federal Medical Center. So how do we ensure as a body that while they are getting their training and competence to do their job, they are also getting that emotional empathy as part of the training? It's a must and it's compulsory for them to be able to be effective. And how do we check them before we sign them out for work that they have hit that benchmark, aside from just the competence?
It's nursing is not just a classroom thing. It's not. That's where we are trained how to empathize with patients. So we go to the classroom and at the same time, you're on the field. You interact with patients. There is interpersonal relationship. So your supervisor, your clinical instructors will watch out for all this. You agree with me that in all disciplines, they are the bad ones. But I want to say that we have more good nurses than the bad nurses. But the few that are the ones that people will actually cry and shout. But you have the good ones. Like, if I look at, recently something happened where I'm actually working. A man cannot afford to get the wife's medication. And I saw some nurses coming to me that, Ogami, your son has just been discharged recently and you went on with some of these antibiotics. We have a patient upstairs. Can you bring them? That's part of empathy.
Yeah.
Okay, when we said, they're going to pay, said, well, when she's sitting down, somebody will send somebody, somewhere to come and pay. We have those nurses. But the few ones that are actually tarnishing the image of nurses are the ones that are on social medias. But the good ones, we have them. You will agree with me.
Like that one that was taking picture.
During
with her pregnant patient.
Are you serious? I didn't see that.
It was on social media.
I did it on the show.
Oh, wow. Okay. Wow. But YK had a statement.
Yeah, no, I was just going to talk about when I took Temidire to a hospital in Ikeja. When he came, he had injured himself. And the nurse, I took him to the first one. They were incompetent. I removed him. I took him to this one, and the nurse was so emotional. She was so nice. She was talking to him, and even when she was giving him pain, he would say, "Why are you giving me pain?" She was crying. Oh, I felt so, even me, I started crying because she was so emotional. That is a nurse. But the nurse that will be frowning.
So, Ma, what is the standard? What is the standard? So, is a nurse required to wear a smiling face before she touches her patient?
Cry with your patient.
Or cry with them? Is it, what's the professional standard?
I love them.
Crying is not a standard of practice.
We don't want cry,
We talk
please.
about empathy.
Yes.
You always put yourself in the place of the patient, that if I'm the one who is on bed, if I'm the one who is passing through this, what will I do? So the nurse is expected to be professional. Not to have a hard face, because the way your carry should bring healing, your touch should bring healing, your words should bring healing and hope to the patient. So nurses are not expected to wear long faces, frown, shout, be touchy, and start being nasty. You understand? But nurses are firm. Good. So that you'll be able to follow their instruction and do what you are asked to do. They are firm. They may not just play with you and say,
That
okay.
firmness, some nurses, okay, I stayed in the general hospital for 6 months during a pregnancy bed rest. And one nurse thought firmness is to be a prefect. Sit down. You know, and I was not in a good emotional state because I feared losing my baby throughout that stay. But another nurse stood out for me because she just sort of knew that I needed, you know. So she's firm too. Your baby is not allowed to visit you. Yeah. This is not better, but you should come and, are you okay?
Yeah.
You know, so what's the difference?
That's firmness. That's telling the patient the right thing. Encourage them to do it. Madam, it's 8 hours after surgery. Can you sit up? You assist. That's me. You are being firm. But it's for the good of the patient. You know that patient, when she's getting up or when he's the pain will be there. Yeah. But you don't look at the pain. You look at the gain. So because of the gain, you encourage the pain. So that's just being firm. But being nasty is not being firm.
All right, Miriam.
It's not firmness at all.
Okay, so as a daughter of a nurse, raised by a nurse, I have only wonderful things to say about nurses. I've seen many beautiful, wonderful nurses.
Thank you.
But that does not take away the fact that there are nurses who have acted, you know, away from what the profession, you know, asks of these nurses. And so my question is, what are the disciplinary measures that have been put in place to prevent nurses from acting a certain way? And what bodies do nurses, what like the nursing body has to, you know, sort of vet hospitals and see the sort of nurses that they are employing, making sure that these are nurses who are qualified and not just anyone that can take any amount of money to come and work for them.
Hold our response, ma. I'll come to that. We have a caller, Cash. Good morning, Mr. Cash.
Hello.
Are you there?
Good morning.
Good morning.
Good morning.
Yeah, I'm here. Yeah, I'm good morning. How are you, all of you?
We're fine.
Yeah, please, I want to contribute to this program. Anyway, let me thank your guest. She's very, very educated, and professionalism is very, very good. She has already explained everything I want to say. And I like Sister Yemi as well. All of you, anyway, you contributed a lot. And your guest has said all I need to mention. And she's very, very, professional. And whatever she mentioned, just try to listen to her. And I really commend her as well. And I really commend all of you. So, because it's a fatal issue that we have to try to enlighten the public about it. So that's what I just want to say. And before I go...
Thank you so much. Yes, but you are responding to the measures she asked about.
Yes, I said, you know, initially when I started talking, I said we have a body that controls our education, our practice, our skills. So that same body, that is the Nursing and Midwifery Council of Nigeria, has the right to punish every hairy nurses if reported. You know they cannot be everywhere, but if reported and investigations are carried out, and she's found guilty. Of course, there are measures. And that's why I said every registered nurses or professional nurses will not just do anything anyhow because their license is at stake. That's where I fit from. That's what makes me a mother. You understand? It's part of me. It's my life. And I let it go just like that because I failed to do what I've been taught to do. So the license is at stake. It could be a temporary withdrawal. It could be a permanent one, depending on the weight of, you understand, the offense. So the Nursing and Midwifery Council has the obligation to sanction every nurse, even before you get to that level. In every organization, there are supervisors.
Okay.
They can put on a panel for such nurses, if found guilty. It's either they tell her they no longer need a service in that organization, or they just measure some kind of punishment to serve as deterrent to others. I hope we understand. Yeah. So nurses just don't behave anyhow. But because something is at stake, there are code of ethics we need to follow. You just don't. You don't.
So, Ma, what happens when there's a conflict between your duty and that of a doctor? So recently we had a guest on our show whose wife had died while trying to give birth. And he said that at the hospital, only the nurses were on call. The doctor kept phoning and giving instructions. At what point does a nurse defer? At this point, it's no longer a nurse's duty to the doctor.
Yes, that could only happen in a private hospital, like you said, where the doctor will be at home giving instructions.
Yes, they do that a lot. To
the nurses on duty. It's their business. And the nurses are the employee. So they obey their boss. You understand? So they are allowed to do everything. But the standard of nursing, we all have our limitations.
Exactly.
The nurses know their limitations. The doctors know their limitations. The nurses know when a doctor should be called. And the doctors know when a nurse called, there is a problem. He does not wait. Because we both collaborate. And you will agree with me that in all hospital settings, the two people that actually work on the patients are the nurses and the doctors. Yes. Others, have other things to contribute. But the main people are and that's why most times there are frictions. Oh, I asked you to do this, you do this, I call you, you didn't answer on time. And because of the patient, and nurses are patient advocates. Sometimes you take it personal. Yeah. That if this person is your relative, we will delay, and that's what brings friction. Apart from the job issues, nothing more. So everybody has its limitation. But in a private hospital also, there are documentations that could save a head of a nurse, even while working for a boss. And the boss is a doctor, you're right. Yeah. So that when your organization comes up and say, what have you done? Then there will be, an evidence of what you have done, how far you have gone. Most of the private hospitals are not ready for emergencies. What killed that woman was because there were no preparation for emergency. A good hospital must be proactive. In case I operate this woman and she's bleeding, do we have a blood bank? In case I operate,
do we have oxygen?
Do we have oxygen? Do we have things to keep her alive? But we don't consider, there are, like you said, there are laws, but they are not enforced. And the manpower to enforce such laws are not much. Look at the population of Lagos State. How many places will the farmer get to? So it's the public that will help them.
So like that hospital now, shouldn't they have been sanctioned? Even assuming best case scenario, they're not guilty. Shouldn't there have been, because the guy has not been silent. He has been going everywhere, he has given interviews, but till now, as far as I know, there have been no sanctions against the doctors or the nurses. They are allowed to continue to be...
Well, I will not actually say I disagree or I agree with you, because we don't work in that agency and we don't know actually what is going on, the paperwork going on. You can't just, without doing investigation and just take laws into your hands. Investigations has to be carried out. So I believe something is still being done, and both parties involved, the government would have called them to a round table to hear that part of the stories. So let's still watch and see the outcomes.
Let's talk about Gen Z nurses, for instance, right? See how you're looking now. No makeup, well taken care of. Now we have a crop of nurses who are very young, who want to wear the makeup, they want to wear the nails, they want to wear the long hairs while at work. How are you people accepting it, and how has it been so far?
It's not part of the standard of practice. You may look the way you want before putting on your uniform. But the moment you put on your uniform, that makes you a nurse immediately.
Or once pretty-looking nurses?
No matter the hair you are carrying, it must not touch your neck. So even this one, I pack up. Because that's the standard.
No makeup?
You can, but it must be very, very moderate. Not the one that will be shouting.
Not wedding makeup.
No.
Makeup.
And your nails must be short.
No, your nails must be short, because even for your own good, if you carry long nails, then you carry germs home. You infect yourself. You know, we talk about hospital-acquired infections. So you touch patients, you touch surfaces. So you take home infection, you infect. So for your own good, it's better your nails are just short and clean, so that when you have dirt under them, it will be visible.
Wow.
Paint, uncle.
That's why I said they must
be short.
Plain, short and plain. So
Okay.
that when you have...
You're not allowed to paint colors?
No,
colors?
no, on your... That's your fingernails, no. But you can do that on your
toenails. Oh, okay. Now, what about the nurses that take care of old people? We've had some, reports that sometimes they are not very caring towards these old people. They just, push them around and all of that. Does your body pay attention to some?
Well, the people who did geriatric nursing, we call them geriatric nurses.
Yeah.
They are actually trained. But the few ones I see on the social media recently are caregivers. They are not nurses.
Oh.
Yes, they are caregivers. Caregivers are quite different. They are just trained to take care of the old people.
They are not nurses.
They are not nurses. But the nurses who work in old people's home, they are actually trained, and they are there for preventive, so that they don't get infection. If they have, they are there to promote their health. They are there to rehabilitate. They are there to reassure. You understand? And there are other people working with them. You understand? But the qualified nurses are not the ones who see on social media pushing the old people. One fell, one hit his head, and when we went through, they are just caregivers.
So nursing seems like such a tough job.
Yeah,
it is.
And I would like to ask you personally, if you find joy from nursing, and what gives you that joy?
Well, I would say I'm a born nurse. I love what I'm doing. When I became a nurse, I just love it and I went into it. Really, I wanted to be in the hospital setting. But actually, I don't know what I really wanted to do. I later decided to do dentistry, and my cutoff point for JAM was not really meeting up. Somebody said, but you want to work in the hospital. Do you like being a nurse? I said, okay, will I work with people? She said yes, and that was how I was introduced. And I find joy from a student nurse. And I've been working, like I said, for over 22, almost 25 years. I left school, and I've always enjoyed every bit of it, because I always have somebody to talk to. I have somebody to give hope to. I have somebody to reassure. I have somebody to monitor. I have somebody to hear good news from. I have somebody to empathize with.
You love your job.
Well done. You have brought me to my next
question.
Problem with nurses.
Okay.
When my sister was dying, the hospital, the nurses, instead of treating my sister, they were praying.
Hi. Same happened
I don't understand.
They were praying for her. I mean, already, she's in a bad state.
Okay.
I believe that even if you want to pray for her, pray in your mind, not to the patient that is dying. A lot of hospitals do that. They leave the work because what you are doing, you are supposed to be providing her care.
Oh, this is our country.
Not sitting down and praying for her. I walked into her room one day. She was really upset. She was visibly upset. She was dying already.
Ew.
And you are sitting down there and you are praying for her. I was upset.
They told me to speak in tongues. Yeah. You know, said, Madam, Shebi, you can speak in tongues.
What do they do about these complaints? There are many.
No, they have conflicts in their roles because they are not allowed. You can actually pray inside of you that, wow, there are some conditions that you know they are terminal cases, that this patient is going to die. There is no hope. You know, you don't have to bring your religion to your job. You know, most Nigerians are just religious.
I was going to ask, you know, earlier, apart from my experience, apart from, you know, midwives, nurses just, you know, sort of help you to manage your pills, take your vitals, you know, their care is not really that as intrusive as that of a doctor. And what exactly would a midwife even do that it makes her come into a patient, you know, help to deliver, touch her and all of that? What's the difference between that?
Well, like I said, everybody has their roles. All roles are unique. There is no one that what he or she does is irrelevant. For a midwife, when you talk about, you know, vaginal deliveries, they owns it. You don't see a doctor coming to take vaginal delivery, except there are complications.
Use them?
For induction, you get the doctor to assess. You know, the work of the doctor is more of curative. So you get them to assess, okay, this patient can no longer continue in labor all by herself. We need to assist. So they can do that while the midwives continue to monitor until the delivery is achieved. But for touching, for hearing, for heartbeat, for checking your tummy, for checking you from head to toe, monitoring your diet, monitoring your vitals, making sure everything about you is okay for the baby, it's the work of the nurse. You know, I think in the 80s then, or early 90s, where nurses also, the midwives, they are allowed to have their midwives clinic, if you ask me.
Yeah.
Before things overrule it. That's what they do. It's only patients who you envisage that, look, vaginal delivery, like I said, will not be okay. Then you will make a referral.
21.
So everybody has their own role and their part to play in the care of the patient.
Thank you so much, Ma, for joining us on the show today. We really enjoyed your insights, and I hope that everybody's watching. Now we know how to hold our nurses accountable, and we hope that the bad ones will be fished out so that they stop spoiling the names of nurses. We believe that we have very good nurses who love their job, who care for their patients, and who we love to see from time to time.
Thank you.
That's all we can take on the show today. Thank you, ladies. We'll see you guys again tomorrow. Bye-bye now.